Hello, everyone. I hope you're all having a wonderful day. We want to thank you from the bottom of our hearts for joining us on this important webinar today and showing your enthusiasm and your commitment to providing person-centered dementia care throughout the pandemic that we're currently facing, that is COVID-19. So we will be sharing this resource when we're finished, as well as any tools that we do reference throughout the presentation. Please feel free to share it with your colleagues. There will be the shareable link as well as any tools and resources that we share. So please feel free to share any of this information with your colleagues. We are very excited. We have representation from across the world on the call with us today. And we hope that you find lots of relevant information, resources, and a way forward as we go through this disease, because one thing that we can be sure of is that no matter whether we are living and dealing with COVID-19 or not, many of our clients are still living with dementia. So whether it be that you're in hospital settings, in healthcare, long-term care, or skilled nursing, or you're providing care and support at home, we hope that you'll find this a valuable session and that you gather lots of information. So I'm Ashley King. I'm one of the co-founders of Person-Centered Universe. Alongside me, I have Jim Kinsey today. He's with Planetree International. He's the Vice President of Engagement Strategies and Continuum of Care Services. And Daphne Noonan, as well, are my co-founder of Person-Centered Universe. So before we get too far into it, we do want to ensure that we provide a few disclaimers. So as you may be aware, we are not experts in infectious disease and pandemics. That's not what this conversation will be about today. And we encourage you to pay attention to the WHO and your facility guidelines, as well as your state or provincial guidelines when looking at infection control and those types of things. We also want to share that our comments are based on current knowledge and recommendations as of today. For any of you, I'm sure for all of you, the information is rapidly growing and rapidly changing. And so we are utilizing the information and resources that we have accessible to us today. As well, none of Planetree or Person-Centered Universe's recommendations are meant to override your local regulations and requirements. So please ensure that these are supports and these are to be used in unison or as a complement to your local regulations and requirements. And we believe that information is so powerful and so important. So ensuring that we're using CDC as well as the WHO guidelines in conjunction with local regulations for you to make your most informed decisions and to provide the most person-centered care.
There we go. Hi, everyone. Sorry, I was still having a hard time unmuting myself. So I guess I'm just going to kind of ground us at the beginning of our presentation in this thought, because I know obviously in times like these that we, as health providers, and particularly those of us who are working in environments where we are supporting individuals living with dementia, we really, really, really want it to be rocket science, don't we? We wish there was a silver bullet answer to help our residents and our patients and clients that are living with dementia. Unfortunately, right at this moment, I guess unfortunately, there is kind of no silver bullet answer to it. But the good news is that we are already equipped to provide support in whatever environments we're working in. I promise you that if you just kind of take a moment, take a breath, And remember the tools and the foundations that you have set up in your own organizations for individuals who are living with dementia. So care plans, different processes and policies, different types of programs and communication tactics and whatnot that you already have in place. I think that that's where you're going to find the comfort in this. It's often really hard when we are in a time of crisis in particular to just kind of breathe and remember that we have everything we need. We all woke up a few weeks ago or a month ago in a very different world than what we were used to, and everything some days it feels like everything's been taken away from us. Everything has changed. But what hasn't changed through the pandemic of COVID-19 is the knowledge that is in each of our heads. So we want to just start off with this quote, which is a favorite of all of ours, from dear friend of Planetree, Laura Gilpin. So it says, "What patients want is not rocket science," which is really unfortunate, because if it were rocket science, we would be doing it. We are great at rocket science. We love rocket science. What we're not good at are the things that are so simple and basic that we overlook them. So I guess I just want to conclude this thought by encouraging each and every one of you to just breathe and remember what are the foundational things that you already have in place, that you already have at your disposal when you're going to work each day, and really dig deep and make use of those things.
Ashley, I think.
Oh, can you hear me there now? Okay, so Daphne so eloquently put it that what we'd like is rocket science, and it would be so much easier if it were rocket science, but unfortunately it's not. So what we've done is we've created this is a bit of a pyramid to identify some foundational components of how we can deliver person-centered dementia care. And in the face of COVID-19, that is still important. It's still important to review and respect and apply person-centered dementia care. It just looks a little bit different. So if we dig a bit deeper into those foundational components that we found through our consulting work, we've identified 3 key aspects for organizations to embody if they're seeking to truly move forward toward an environment focused on person-centered dementia care. So initially, you'll see at the bottom there, the integration of tools and resources, and taking the time and spending this hour with us today is a great way to begin to integrate those tools and resources. We'll also be sharing with you some tools that we use in our consulting work and that we share with clients. And that can help you kind of start on your journey towards gathering practical tools, as well as tips and tricks, because they're all essential in providing person-centered dementia care. Aspects and programs like narratives, as well as integration of personal routine and preference, is also a really important way to integrate tools and resources. And we can look at it in different ways, like staff huddles as well, are ways that you can start to integrate key client information into processes. We then look at process and policy review. So how do we integrate processes that support the individual who's living with dementia and see beyond their medical care and their medical diagnosis? Identifying quality of life indicators, as well as integrating psychosocial supports, are ways that we can more deeply embed person-centered dementia care into organizational processes. And as we all know, especially any of us who are leadership on the call, it's about leadership and staff recognizing and appreciating the vision. So leadership really providing the direction and supporting staff and those who are caring for individuals who are living with dementia to confidently be able and feel like they have the tools and the resources necessary to provide person-centered dementia care. So I want you just to imagine for a minute that you're in a place you've not been before. You're not sure how you got there. There's no indication why you should be there. And the people are whizzing past you in full medical garb, masks tied tight, these yellow gowns that smell sterile and look like someone is going in for surgery, gloves pulled all the way up to their arms. You don't feel sick, but why else would someone be wearing something like that? What are they saying? It's so hard to understand behind those masks. Everything is so muffled. So that can be a pretty scary thing if you imagine not understanding what's happening right now. But for most of us, I'm sure, we're starting to experience that reality as care providers. So when we think about what it would feel like to be living through this pandemic instead of caring for people in this pandemic, like most of us are, we truly are able to empathize and understand why certain behaviors and why certain reactions are happening for our clients who are living with dementia. It allows us to really think about how they may not be able to understand what's going on. You know, they don't recognize that those infection control protocols and that personal protective equipment is vital to our well-being. They might not remember, even though we've told them, that the COVID-19 pandemic is happening. And they may not be able to articulate that they're scared. So instead they use behaviors to try and communicate how they're feeling and why they're feeling that way. So we'll get into, through the rest of this presentation, some ways that you can identify and some ways that you can help support our clients who are living with dementia so that they feel, although they see visually that we're in an unprecedented time, encouraging other aspects of our care to be more inclusive and more supportive of our clients who are living with dementia.
So one of the things that's real important for us to discuss as we talk about living with dementia in a time of a pandemic is to really look at what it means to be isolated and what the impact of isolation has upon individuals. Whether or not you have any form of cognitive impairment, isolation has been linked to loneliness and depression and poor sleep quality. There is this impairment that comes to executive function, and it accelerates the decline of your cognitive ability. There's also poor cardiovascular function, and there's impaired immunity at every stage of life. And I think what's essential for all of us to understand as we go through this together is that these outcomes actually are potentially our outcomes. And so when we talk about self-care later in our presentation, I want you to refocus on how do we prevent some of these outcomes because isolation is more than physical. However, if you are living with dementia, it increases the impact of those other outcomes, but it also adds an increase in circadian rhythm challenges. Those individuals that are living with dementia that already have sleep disruption or already have a difficult time discerning between night and day, when in isolation, it even begins to limit further the visual or environmental cues that would assist with redirecting the time of day or redirecting sleep. Behavioral responses will increase as a result of either our preventative measures, such as our personal protective equipment, social separation or physical distancing, really our care and the restrictions we're placing upon individuals. I've talked with many clients over the last week that are just so challenged in trying to maintain that physical distance between persons living with dementia that are in congregate living settings. There's also accelerated memory loss as a result of limited engagement. There will be a change in eating patterns. All of us know that eating is such a social event. And for persons with dementia, they often will take visual cues from other individuals at the table, and they will know what to do because other people are doing similar behaviors. When we have to separate to eat because we can't be in large groups, or when we have to separate to eat because of infection or isolation, then it changes the individual's eating pattern. And then overall physical decline can happen and start to occur. And that starts to occur mainly because of the limited engagement, maybe because those persons that are isolated from other individuals are not able to engage in exercise programs or engage the way they previously engaged. So it's important for all of us to support not only persons living with dementia, but each other. And Ashley and Daphne and I are going to take you through some key areas of intervention that we believe are important to take a look at differently through the lens of providing care for those living with dementia. And those topics are going to be communication, the actual provision of care, innovative practices for staying engaged, and then how do we stay connected with each other?
So, as Jim said, one of the key components of getting through this, alive, if you will, is about effective and efficient and personalized communication between you and your client who's living with dementia. Because how we communicate, and especially the words that are coming out of our mouths while using personal protective equipment, are significantly important, and they will continue to be until we're through this. So begin where your client can succeed. So instead of saying, "Hi there, how you doing? Where are you from? What's your name? Oh, I need you to get out of bed this morning." Start slow and steady. Help meet the person where they're at. And usually, especially in these situations, we want to qualify or quantify why we're wearing this equipment. But take your time and slow down, slow your pace, because our visual experience, what we'll be showing up as, is going to be challenging enough for someone to understand. So taking our time, slowing down, and being careful and deliberate about what we say will be really key in communicating effectively with our clients living with dementia. Thinking about what you'll say to explain what you're doing and using person-first language is really important as well. So be mindful that war language like battling or the pandemic could scare someone. Again, we're thinking back to the fact that someone may not know and may not remember that we are going through a pandemic. So how can we use language that is not battling and that is more inclusive, and so that we're not scaring our clients? Because we know that these circumstances, they're changing every day, and they are challenging, and they're scary enough for us. So how can we use person-first language and be empathetic in the language that we use? As much as possible, again, going back to starting slow and steady, ask yes or no questions. So providing short, do you want this or do you want this? Would you like to do this or would you not like to do this? Are easy and great ways for someone to be able to follow your lead, follow what you're asking, and be more capable and able to share how they're feeling or what they actually want in that situation. take your time and break the task or the activity into small and easy to understand steps. So again, instead of going in and saying, "Hi there, Betty, we want you to get up today. It's really nice out. We want to take you out to the dining room for breakfast. So why don't we stand up and we'll get washed up for dinner," or for breakfast, excuse me. Say, "Hi, Betty, we're here to take you for breakfast. How about we get up?" Slow it down, use short sentences, and if you can, use props. That's a great way to better convey and communicate your message. So that if the person is maybe not able to recognize or specifically identify a word, using a cue or a prop to better quantify what you're trying to say for your client can be really helpful and help them to better understand. So if you're taking them to the bathroom or the bathtub, excuse me, using a towel and shampoo is a great way to show them and demonstrate to them what you're planning on doing. And give manageable choices, as we said. So making sure that we're using, short, easy to determine communication. So do you want the red top or the blue top? And have the two tops available so then Betty can choose which top she wants to wear. And provide assistance only if required. So if someone's struggling to find a word, kind of watch their facial expressions. Are they grimacing? Because then you probably should step in. But if they're talking and it may not make sense to you, but they're trying to convey themselves and they seem happy about it or comfortable, allow them to speak and allow them to communicate what they're trying to say. And through our use of personal protective equipment, we have to be really careful, more mindful than I think we ever have to be. And we often, share and work with our clients on your nonverbal communication is just as important as your verbal communication for someone living with dementia, but even more so now. Because again, we're going to be in these great big yellow baggies, and we're going to have gloves on up to our elbows, and we have some semblance of a face mask. So using hand gestures sparingly, I'm not doing a very good job right now, I'll say, but using hand gestures sparingly to avoid the person feeling threatened. So instead of, going up and kind of having your hands moving in all different directions, being mindful of the hand gestures that you're using and only using them when needed. Approach with an open body and open hands. This is something that we have found to be incredibly helpful, usually with your hands down a bit, so that you are showing that person that you're here for them. Turning your body so that you're facing them, opening your hands, and it's just showing general openness. Try not to seem overpowering or cold. So now more than ever, your verbal and your nonverbal communications are going to be what connects you with your clients. So the more that you can give them that reassuring tap on the shoulder or rub their back if you can, is going to be very, very important. And when utilizing personal protective equipment, try as much as you can to smile with your eyes. So, letting the corners of your eyes turn down, sharing as much as you possibly can with those eyes, because that's going to be the only piece of your body that is being shown to that person. And the only way that you as two people will be able, that they'll be able to see your skin and see your face. So, pay attention and be mindful about how your eyes are conveying the message. And as well, looking at, as I said, your body positioning and how you present to the individual. So make sure that you're open, that you're showing collaboration and showing willingness to work with your client so that they feel more comfortable and confident with you. because they're going to be working off of nonverbal communication significantly during this time.
Okay, so I'm going to just come in here for a minute and just take a couple minutes to talk about the communication between the team during this time. Obviously, communication within the team is important every day, but during a time like this, it's just so key to the approaches that we will then employ to our residents, our clients that we are trying to help. So in what we've, I guess many of us on this call probably have lived through now about 4 weeks of not so business as usual, so to speak. So one of the things that, I have learned personally in my leadership role is that you simply cannot over communicate with your team during a time like this. And they cannot over communicate with one another. So one of the things that we kind of quickly learned in my role at Nashwauk Villa as we navigated through the changes and things, information is rapidly changing on a daily basis and sometimes even on an hourly basis. Some new communications coming out from regulatory bodies and whatnot. And so we for the first couple of weeks, of course, as leadership team, we were trying to just kind of stay very much on top of all of the information that was flowing and making sure that we were getting that information out in a timely fashion, which was important. But then we kind of brought our heads up and we realized, the pragmatic communication is one piece of that puzzle, but the other really, really important piece is for your staff and your team to be able to experience more personalized approaches to communication and just the creation of space for people to talk a little bit about how they're feeling or how their day's going, and just ensuring that there's a personalized approach instead of just kind of sharing the protocols and the information and the regulations and whatnot. So we've kind of slid into, last week a little bit, just using personal examples of my context, just really deliberately looking for ways that we can have that personalized approach. So open door policy, doing a quick morning huddles. Obviously we can't have large general staff meetings, but we at Nashwauk Villa, we actually did a whole day where the leadership team was kind of camped out in our boardroom, and we had like small groups of 3, 4, 5 people that were coming in, and we were spacing, physical distancing from one another, but at least just talking through the examples of what people's questions were around the key communications. So really important, and it is really important because it then creates a reduction of the anxiety for the individuals, and they feel a little bit more connected to their leadership team, to one another. They recognize that they're all feeling the same way, and so it then translates into really better approaches to care for the individuals that we're caring for. Another big thing is to be very, very I guess, concise and transparent in all the communications. Different days we've had experiences where, I maybe don't have the answer to a key question that the staff are worrying about. But I'm just honest about that. And there are other days where, you might have an answer, but nobody likes the answer, including you. So it's just being honest about, factual information, avoiding kind of the dramatization of the sharing of information. So no kind of negative language, just really being cautious about not trying to create, a panic or crisis kind of language that really could add to people's anxiety. And, really just encouraging everyone to practice kindness and compassion and hope for one another. And, we've been saying to each other for the last few weeks in my workplace is that, everyone just needs a little bit of extra grace. And we all just need to recognize that, things that are happening, whether it be, responses from residents or maybe even just within the team, it's not personal. It's just an expression of how people are coping, how they're feeling within this kind of environment that is so uncertain. It is also really, really crucial to, encourage people to, within the workplace and outside of the workplace, to, have conversations about what people are doing with self-care. We see one little example that we have here on the slide that it's just, it could be literally just a quick daily check-in, either between caregivers or at huddles in the morning or something like that at the time of the gathering at the beginning of the shift, is some key points. So what are people grateful for? Who are you going to check in on or connect with today? What are you going to let go of? Things that you can't control. How are we going to get outside? How are we going to move our body? And what kind of creativity or beauty are we going to engage in today? To kind of keep our souls filled. So we've been, really trying in a lot of our conversations to ensure that we're inserting just some of those kinds of thoughts, because it really is so crucial for people to, again, when you're anxious and you're taking in media. I'm sure many of us have probably tried to go on a media diet in the last couple of weeks. It's important to just kind of ground people in what their normal self-care techniques are, and just to kind of help people bring their heads up from all of the kind of chaos that's, being presented to us, and try to find a little peace, even if it is just for 5 minutes to walk outside or whatnot. So I would say, before we kind of move on from this topic, I would just say that we would love to hear about some, easy examples that people on the call are doing within their organizations to help with this. And if you want, you can please feel free to send examples, little write-ups in the chat box to us, or even in a response. We're going to be sending a follow-up email with all the information and the goodies from the slideshow. So if you have some really great techniques that you've employed to help your staff with communication and self-care, we would love to hear those, and we can share them with the group as well.
Thanks, Daphne. So Daphne and Ashley both really covered communication around addressing protective personal equipment, or as I like to call it, the yellow blob, because I felt like that's always what I looked like whenever I was going into an isolation room. But I think that we really have to talk about the emotional and, in some cases, psychological response of a person living with dementia to this experience. And we've talked a lot this afternoon so far about what does a new normal look like, and I think that for us to process that is difficult enough. And then when you are living with dementia, to try to even understand on a quote unquote normal day what's happening in my surroundings, it becomes so much more when things so significantly change. And so it's important to be sure that the approach is calm, and that we're using the individual's name, and wherever possible, provide the individual with the opportunity to actually see you before you have to get in to all of your personal protective equipment. Now, I realize that that is not going to be possible in many situations and in many organizations. However, I think we need to also become somewhat more creative in how we express ourselves and how we're able to connect with the individual immediately. And I heard this morning on our weekly staff huddle that there was an emergency room physician that printed out a photo of himself without personal protective equipment on, and actually had that clipped to the outside of his personal protective equipment, so that people that he was caring for could really see who he was underneath all of that. I think that that also transitions to acknowledging that the PPE exists. I think the worst thing that we can do is not express the abnormal. And whether I can cognitively process that you're wearing personal protective equipment or not, I as a person living with dementia, am going to recognize that this is not normal, and that there is somebody entering my space. Remember, a space where hopefully individuals feel safe, and this person is entering my space where it's not normal, where things are not happening the way that they always have. And so your eyes and your eyebrows are your communication device, and ensuring that they match what it is you're saying is going to be real important. I think the other piece that is most important for us to remember when providing care in isolation or with protective equipment is to really understand that anxiety and stress are contagious. And what we need to be very mindful of, and really just taking a breath before we begin to care with an individual, is that anxiety that we feel we can transfer to the person living with dementia unintentionally, not because we want to, but it's really a challenge right now for healthcare providers and even family caregivers to really provide care in a non-anxious way. And I think one of the things that is most concerning about the length of time that this pandemic continues is that ability for us to maintain that level of stress, maintain that level of heightened awareness, is going to erode over time. And as that erosion takes place, that transfer, particularly to persons living with dementia, is going to become increasingly more difficult to mitigate and to reduce. And so it's important that we're intentional in describing each step, that we're intentional in following what the individual is telling us, either verbally or non-verbally. And we have to be aware of how to adjust and respond in the moment. The other piece that I wanted to share is that we also have to give up our preconceived ideas of what being finished means when we're working with persons living with dementia. We, in the caregiving realm, always develop routines, and those routines help us keep, our care organized and our care efficient. And where we are right now is that those routines, while important, will also serve as a barrier over time. And so one of the ways to reduce anxiety within the workforce is to give up preconceived ideas of what finished is, what my work is versus what your work is, and really begin to look at how do we create that cadence of a day in a life that we always talk about when it comes to person-centered care in senior living. How do we strip away those concepts and those ideas, and how do we make that the positive outcome of the situation that we're in?
Thanks, Jim. And that's so true. Given the fact that we are in, you've set the stage so perfectly and identified that our clients are going to continue to be confused. They're going to be frustrated. And, the day in the life is going to be ever changing, at least for the foreseeable future. And so confusion and frustration, can lead to behaviors that negatively affect the quality of life of the person who's living with dementia and their care partners. And when we think about the yellow blob walking into the room and everything that Jim has just said, we are causing, not because we want to, but because we have to, significant confusion and frustration for our clients. And one way that we can really help to support our clients and give back the opportunity for them to continue to function independently and mitigate and better their self-esteem, which will be incredibly key right now, is about providing them the opportunity to elicit choice and preference in their day-to-day life. So how do we, during this time, how do we boost that up and improve that? And then a few ways are by balancing assistance with capability, mitigating risk and autonomy, and maintaining independence. So how do we support independence and determine the appropriate amount of stimulation someone may need and level up the engagement that we may need to provide to someone? So it's really about taking the time to get to know the person, understanding their capabilities, and how they confidently go about their day to help maintain their independence. So it's really important for us to maintain as much independence as possible, but ensuring that if someone, we have to pay very close attention to someone's facial expressions, how they're going about a bit of care. So if someone is brushing their teeth and they're looking at the toothbrush, maintaining that independence is going to be really important right now, because again, the yellow blob coming at you, I'm going to continually use that term now because it's much easier to say than personal protective equipment and somebody in it. But the yellow blob coming at you with a toothbrush in their hand can be incredibly confusing and frustrating. So instead, providing that and your clients the opportunity, if they're able, to hold that toothbrush in their hand and just watch, pay attention. Again, go back to, things are going to be changing. So pay attention and see if they're able to put it, the toothbrush to their mouth. If they're not able to put the toothbrush to their mouth, help them and see if they can do that. If they're capable, allow them to brush their teeth. That way you can go out, do your own thing, start working on the next activity of daily living that you need to complete with this person. So not only are you able to provide, set up the next activity and time manage and prioritize a bit better, and take a bit less time actually providing for someone or doing for someone, and you're also boosting someone's self-esteem, boosting their quality of life by giving them the independence to complete that activity of daily living on their own, and thus decreasing confusion and frustration. So sitting back and observing is really key to understanding how much someone can do when it comes to their daily care. So just like, in person-centered organizations that are, deeply person-centered, it's about allowing or encouraging the person who's living with dementia to direct their care. And so by us sitting back and observing and recognizing how someone is doing their activities of daily living is a really great indicator of how much support you can and should provide. And if we're able, continuing to do that is going to mitigate confusion, frustration, those responsive behaviors that often happen with confusion and frustration for someone who's living with dementia. And it can also help them to feel more independent and autonomous in their experiences. So it's also important for us to mitigate risk, as we know, while encouraging autonomy and self-determination. And you know, it can be challenging, and this is a challenging factor, or challenging to identify or to get in the groove of, if you will, and potentially, if you're not currently looking at mitigating risk for your clients, now might not be the best time to implement, but, you know, reviewing, really looking at how people, you know, I personally, I love to ski, well, actually snowboard, but I love to go out on the slopes on the weekends. I know that it's a risky behavior, that I'm likely, you know, to get bumps and bruises, potentially a concussion or a broken bone. But because the activity keeps me active, gets me outside, and provides me great joy, I choose to continue to do it. So taking the time to work with families, whoever the power of attorney is with the client, and care teams to balance risk and that autonomy for clients. It's a key aspect of providing person-centered dementia care, and it can also help to maintain autonomy, independence, and increase self-esteem. So we could essentially provide this one slide and a whole presentation. But so for today, that's a good synopsis, or a high level identification of how we balance providing assistance and mitigating risk and autonomy. But really it's about encouraging as much as possible independence when able, boosting and improving self-esteem of your clients, and maintaining good quality of life as much as possible to decrease confusion, frustration, and those responsive behaviors.
Okay, so I'm just going to take, we do have our time is just flying, as I'm sure everyone's noticing. We do have a few slides where we wanted to share some practical kind of interventions and suggestions with you. So I'm just going to touch a little bit on kind of what Ashley, I guess building on what Ashley was saying, is that, you know, the importance of knowing the individual's narrative has, you know, becomes extra important during a time such as this. You know, we know, and this goes back to what I said at the very beginning of the conversation today, is that we already, in so many cases, we already have key tools and key processes in place that we've built. You know, when someone moves in, do we create a social profile and a narrative, a client history and whatnot? So we may already have tools and processes and programs in place that we just need to kind of, if we can just breathe and go back to those basics and know that, you know, those tried and true methods can work at a time like this. So, you know, knowing the person's narrative and then weaving that into aspects of care. So I'm going to show an example in the following slide about it's called All About Me sheet, and we will actually share that with you all. So just, I'm not going to go to it yet, but, you know, some of the suggestions that, you know, if you've already implemented things like a bedside sheet that tells about the client, utilizing that information, and it like, for example, it might say that they, you know, what their daughter's name is, or what their you know, their son might end up, you know, being their son is a police officer or something like that, then you can engage in those kinds of conversations on what you know about the person, if you think that it would help calm them and to, you know, help them feel connected to you, that you know about them. So if you don't already know, you know, using some of your internal processes to gather clues, maybe organize a Skype call with the family. You could send, probably a lot of family members, especially in long-term care, are feeling very helpless right about now, in the sense that, you know, they can't see their loved one, they can't, you know, they're not, if the organization, the home is closed, maybe send them a little survey to help them fill in some of the blanks if you're struggling to find out information about their loved ones. If you have things like an iPod, for example, an iPod program already in place with personalized playlists. So that's a really practical tool that if you know that you are going to have to go into someone's room with an isolation kit, you know, on, and you're wearing the yellow blob, as Jim says, and, you know, all of that protective equipment, maybe you could go in and administer the iPod about 10 minutes before you have to provide care. And then it could provide, you know, that narrative kind of music lens of support for them, so potentially relax them and help them not to panic. I'll just get Ashley, if you want to click to the next slide for me, and I'll just touch really quickly on this tool. And this is one that we will send out to everyone, but it's a quick tool that could be done and then drawn upon, and it could easily be placed somewhere in the resident's room for staff. So the resident's photo, if you look, the first on the left-hand side, the bottom box is what it says, what those who know the person say that they like and that they admire about that person. So using that box to kind of, you know, talk about key character traits of the individual. What is important to the individual is in the top box on the right-hand side. And then how best to support the individual. So it's just a quick kind of cheat sheet, if you will, that could easily be placed as a visual for staff to be able to draw upon. So I think, yeah, so we'll leave that there, and we're going to give you some little tips and tricks of different things that are working in various places now.
Exactly. So now we're going to switch gears a little bit and provide you some practical tools for communicating with families, with colleagues, and with the community. Some that you're probably already doing personally. I know that I've had lots of Skype and Zoom dates over the past few weeks with friends from across the country, getting together and sharing. So utilizing things like FaceTime, Skype, and Zoom meetings to continue to maintain that social and family connection. Many of you have seen probably pictures of hallway bingo where there's people kind of scattered in their rooms, but they're still able to physical distance. And having visits at mealtime, so utilizing and maximizing that time at mealtimes. Accessing telehealth, it's becoming increasingly popular in Canada and the US anyway, and how we can utilize the telephone to still connect with our healthcare practitioners. I don't know about everyone else, but I have been loving the fact that I can do yoga every single day. I can access it, a whole hour-long session, all online. So using YouTube videos and other physical care and physical health providers to provide exercise videos and exercise cues. There's also apps for mental stimulation, such as Calm, 10% Happy, utilizing Sudoku and crosswords, and utilizing music therapy. So we recently actually began engaging our music therapist through Zoom at an organization I work at. So we are able to access her and work with her in a therapeutic way, maximizing and utilizing technology. So it's also really important when we are utilizing technology and creativity to engage our clients. It's very important to use infection control protocols and really continue to uphold the standards for infection control that are set within your organization. For us, we do have some communal equipment, but it's necessary that we use infection control protocols every time we use the piece of equipment.
Okay, so I'm just going to give a couple of examples. So some exciting things that were happening at within my workplace last week, where we really utilized the music therapist that we have, who's wonderful, to help engage our residents, many of whom have dementia, in the whole topic of this pandemic that we're experiencing. So myself and my director of care, along with a couple of other key staff, actually arranged an educational session with some residents, so that we could actually describe to them what was going on, because we had gone a couple of weeks and, visitors weren't coming and whatnot. And then, so we actually held a discussion group, and it was excellent. But we asked our music therapist to be present so that she could facilitate a session where they could write a song. So they wrote a song to the tune of On Top of Old Smoky, and it was all about being under quarantine during the pandemic. And we then placed it on a Facebook video so that our loved ones and our volunteers could see it. And it was, let's just say it was a hit. Anyway, it was excellent. I'll just, maybe if you want to click to the next slide, Ashley, I'll just kind of highlight a couple of things that we found useful, different kind of tools. My activity director, the bottom photo on the left-hand side, our activity director created this board with like different puzzles and crosswords and coloring pages and whatnot that could easily just be grabbed by the residents if they were looking for something to help, to be engaged. And then, of course, bingo is always the ever popular activity in many long-term care homes. And you see a great example here from another organization, long-term care organization in the States somewhere in the US. And they're practicing physical distancing while they're still engaging in that ever crucial activity of bingo. So we thought those were really great, just examples. So I'm going to talk for just a minute about aromatherapy and the use of essential oils. So we have a really active, in my long-term care home, a really active essential oil program. And of course, in a time like this, we were a little bit nervous at the beginning of all of this, thinking, oh no, will we have to stop because of infection control issues and whatnot. So we consulted with our medical director, and we ended up really, finding that we can continue to use the aromatherapy and essential oils with just some considerations. So the method of administration may need to change. So we don't want to be using diffusers during this time, because what we know about this virus is that it loves moisture, and we don't want to be diffusing any moisture into the air through the use of essential oils. We do know that some oil blends can be very helpful to reducing anxiety and helping with sleep. And so that was why we really wanted to continue to use, especially for many of our residents that are living with dementia, it's really can be helpful. So we've come up with a couple of different ways that we can administer the oil. So one, during the night, if you place a little cloth or a gauze sheet underneath the pillowcase, on top of a pillow with the blend of oils, it can help with, they can administer the oils that way while they're sleeping. And then throughout the day, if you have individuals who you're, used to either through massage or different things that you're using to kind of help with anxiousness, our aromatherapy expert in-house came up with the idea, it's brilliant, of these little felt, little felt pads that you use. Oftentimes you'll see them on the bottom of furniture and whatnot, so they're sticky on one side, that we can stick them underneath someone's clothing, just kind of, in their collarbone or whatnot, and it's not invasive, and then you put the oils on the felt themselves so that they can get the aroma and stuff. So those are just some tricks that we've employed, and so that we can continue to use that very, what we consider to be a very crucial initiative.
Absolutely. And just adding on the use of aromatherapy and essential oils, now more than ever, again, just like us physically being present and being able to communicate effectively, it's really important for us to maintain the sense of touch, because we don't know how long this is going to continue to go on. So how can we continue to make people feel comfortable, continue to show our empathy and our connection with people. And one of the easiest ways is by using gentle touch. And of course, it's, we have to maintain those infection control protocols that are identified in our representative organizations. So how, identify specifically what's happening within your organization, and then utilizing with those guidelines, ways that you can provide touch and support and connection to your residents, because that will be important. We all need human touch. We all need a hug once in a while. And if we can't hug, what else can we do? What other ways can we continue to support that touch? Another great resource that we're very lucky to call our friend is what's called the Sleep Kit. And it's really, the Sleep Kit is about taking a caring approach to sleep by encouraging a series of engagement activities, from a cup of chamomile tea to reading Tom Sawyer before going to bed, as a way to mitigate the struggles of shifting, shutting off a busy mind and shifting and preparing the body for rest. So we will share the information about the Sleep Kit in our follow-up email after this presentation, including all of the slides and the information.
Thank you, Ashley and Daphne. And it's amazing how quickly time goes when you're having a good time talking about what you love. And my role now is to kind of pull us all together and send us off with a call to action. And so, we have summarized really how to connect with individuals and families and how to connect with the community. But most important to these connections is to really understand that physical distancing does not equal social distancing, and that although we cannot be close, we can still be connected. Oop, there we go. And so, some of the resources and some of the tools that you can have to continue to have that psychosocial well-being, we've already talked about the online apps and the online websites, but also how do we engage in a pen pal program during this time? And how do we engage our volunteers? So many of our volunteers are still looking for things to do and for ways to help. And that also brings us to really talking about a program called True Doors, which we'll also be able to include information around this. But True Doors is a process by which an overlay is placed upon a resident's door, and that can be done at 6 feet or more apart from one another and still have an engaging time. And then finally, the platform Zoom has become instrumental around the world right now in creating connections and making sure that we all stay connected with each other. And I know that your 3 speakers today have actively participated in a number of virtual cocktail parties, and believe it or not, it works really well. And also, it's a great way of just staying connected with friends and family.
You're telling our secrets, Jim.
I know. Go ahead, Ash. Most importantly, we want to end with making sure that you're taking care of yourself. Whether you are a caregiver at home or a caregiver in an organization or a caregiver in general, this is the time that we have to take care of ourselves. We are not able to help. We are not able to assist, and we will never be able to move through this period of time together without taking care of ourselves. Daphne had mentioned earlier about just taking a break from the news sources and taking a break from the amount of information that continues to berate us on a regular basis. But also, take a walk, get some fresh air, do whatever it is you can do that takes care of you. Slide. And finally, I just want to let everyone know that since we are out of time, Daphne and Ashley and I will be creating a frequently asked questions and taking the chat information and sending out to everyone's suggestions and everyone's feedback. But we want to simply say thank you. And where healthcare providers and healthcare workers are being thanked continually, we wanted to be sure to make sure that we are inclusive of all of the folks that are taking care of all of us as we go through this. So the doctors, the nurses, the first responders, but also your grocery clerk, your pharmacist, the person that is making sure that food gets to our grocery stores. All of those people are the real superheroes. And so we want to simply close by saying thank you to each and every one of you for continuing to do what you do in the face of uncharted territory. We thank you and we wish you well. Stay safe and stay healthy.
Thanks, everyone.
Thank you all so much for joining us.
We'll see you again soon, we hope.
Absolutely.